Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I'll give a brief overview of what you need to know about cystitis. In particularly, I will cover what is cystitis, how you treat cystitis, and how to live with cystitis. So we start with what it is. Interstitial cystitis, also called painful bladder syndrome, is a chronic condition characterized by a combination of uncomfortable bladder pressure, bladder pain, and sometimes pain in the pelvis, which can range from mild burning or discomfort to severe pain. Interstitial cystitis is a chronic condition. While it can affect children and men, most of those affected are women. Interstitial cystitis can have a long-lasting adverse impact on your quality of life. The severity of symptoms caused by interstitial cystitis often fluctuates, and some people may experience periods of remission. Although there's no treatment that reliably eliminates the cystitis, a variety of medications and other therapies offer relief. So the symptoms. The signs and symptoms of interstitial cystitis vary from person to person. If you have interstitial cystitis, your symptoms may also vary over time, periodically flaring in response to common triggers such as menstruation, seasonal allergies, stress, and sexual activity. Interstitial cystitis symptoms include a persistent, urgent need to urinate, frequent urination, often of small amounts, throughout the day and night. People with severe interstitial cystitis may urinate as often as 60 times a day. So also there's pain in your pelvis or between the vagina and anus in women, or the scrotum and anus in men. Pelvic pain during intercourse, and also men may also experience painful ejaculation. Chronic pelvic pain, and some people affected by interstitial cystitis experience only pain, and some experience only frequent, urgent urination. Most affected people, however, experience both pain and frequent, urgent urination. Although signs and symptoms of interstitial cystitis may resemble those of a chronic urinary tract infection, urine cultures are usually free of bacteria. However, a worsening of symptoms may occur if a person with interstitial cystitis gets a urinary tract infection. So the causes. Your bladder is a hollow, muscular, balloon-shaped organ that stores urine until you're ready to empty it. In adults, the bladder expands until it's full and then signals the brain when it's time to urinate. By communicating through the pelvic nerves, this creates the urge to urinate in most people. With interstitial cystitis, these signals somehow get mixed up and you feel the need to urinate more often and with smaller volumes of urine than most people. It's likely that many people with interstitial cystitis also have a defect in the proactive lining or protective lining of their bladder. A leak in the epithelium, for example, may allow toxic substances in urine to irritate your bladder wall. So suggested but unproven factors that may contribute to interstitial cystitis include autoimmune reaction, heredity, infection or allergy. So the risk factors are associated with a higher risk of interstitial cystitis. First is sex. Women receive a diagnosis of interstitial cystitis far more often than do men or children. And age. Most people with interstitial cystitis are diagnosed in their 30s and 40s. Other chronic disorders, so interstitial cystitis may be associated with other chronic pain syndromes such as IBS and fibromyalgia. Any common connection between these syndromes is unknown. And next, how do you treat the interstitial cystitis? No simple treatment exists to eliminate the signs and symptoms of interstitial cystitis, and no one treatment works for everyone. You may need to try various treatments or combinations of treatments before you find an approach that relieves your symptoms. So first is oral medicines. Oral medication that may improve the signs and symptoms of interstitial cystitis include ibuprofen and other non-steroidal anti-inflammatory drugs to relieve pain, tricyclic antidepressants such as amitriptyline or imipramine to help relax the bladder and block pain, and antihistamines such as diphenhydramine and loratadine, which may reduce urinary urgency and frequency and relieve other symptoms. Second is nerve stimulation. So transcutaneous electrical nerve stimulation uses mild electrical pulses to relieve pelvic pain and in some cases reduce urinary frequency. Electrical wires are placed on your lower back or just above your pubic area, and pulses are administered for minutes or hours, 2 or more times a day, depending on the length and frequency of therapy that works best for you. In some cases, a TENS, T-E-N-S, device may be inserted into a woman's vagina or a man's rectum. And third is bladder distension. Some people notice a temporary improvement in symptoms after undergoing cystoscopy with bladder distension. And surgical options include bladder augmentation, figurative resection. And finally, how do you live with interstitial cystitis? So interstitial cystitis can have a profound adverse effect on your quality of life. Support from family and friends is important. But because the condition is a urinary problem, you may find the topic difficult to discuss. Start with the simplest self-care strategies, such as wearing loose clothing and limiting soft drinks, caffeine and citrus. Wait a reasonable amount of time to see if these measures help, and keep trying new ones, as long as they don't disrupt your life even more than interstitial cystitis already has. Some people with interstitial cystitis find relief with self-care methods such as dietary changes, although no scientific evidence points to diet as the cause of interstitial cystitis. Many people with the condition find that eliminating or reducing their intake of potential bladder irritants may help to relieve their discomfort. Bladder training. These techniques may help reduce urinary frequency. The training involves timed urination, going to the toilet according to the clock rather than waiting for the need to go. And finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist in managing interstitial cystitis more effectively on a day-to-day basis. To start with, we have numerous products to get you started on a mild exercise program. So we have floor mats and weights and other devices. We create a mild exercise program specifically tailored to you. We also have various supplements and products which you can purchase from us without a prescription, such as cranberry capsules, the Cystopurin and Canis Balance, and the Caniston products range. We also stock light boxes to promote relaxation. We have blood pressure monitors and blood sugar monitors and body fat monitors. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of our brand new offering at Telehealth Clinic. You can book a 30-minute clinic with us, and we help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing interstitial cystitis with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.